Assalamu alaikum. Hi friends. Today we will talk about FiO2, big pAo2, small pAo2, and sao2. We have heard these things in many places in pathology, in physio, but we don't know about them very much. So we will talk about today from starting what is FiO2. FiO2 is the forced inspiratory oxygen, is the amount of oxygen which is present in environment. The amount of oxygen which is present in environment in atmosphere is 21%. And when a child is put on ventilator due to some complications of respiratory or lungs, FiO2 has put it set it in the ventilator depend on the child's severity, the amount of oxygen he or she needs to he or she needs into its bloodstream. After that, there is big pAo2 and small pAo2. There is a difference between both them. The big pAo2 refers alveolar pressure, which is 104 mmHg, and small pAo2 refers capillary pressure, which is 75 to 100 mmHg. The big pAo2 refers alveolar pressure. Alveolar pressure is the oxygen which is present in the lungs, and small pAo2 capillary pressure is the amount of oxygen which is present in capillary, or also people say that it arterial pressure. Okay, so after that there is SaO2. SaO2 refers oxygen binding to hemoglobin or the dioxide that's on the hemoglobin. Simple. The big pAo2 and small pAo2. Can you check the difference? Can you know if you know now the difference? You can identify what is has been seen in there. The arterial pressure is lesser than alveolar pressure. The alveolar pressure is greater than capillary pressure. And then there is hypoxemia. Hypoxemia is the low amount of oxygen present in the blood. Let's break it down. Hypo means low, oxy means oxygen, and emia means in blood. Low amount of oxygen pressure in the blood is known as hypoxemia. In hypoxemia, the capillary pressure will be less than 60 mmHg, and the oxygen binding to hemoglobin will be less than 90%. Let's come down here. Anemia. Anemia, you already know that there is a anemia means decreased red blood cell mass. So capillary pressure will be normal in anemia, and hemoglobin binding to oxygen will also be normal. And we should come down here about carbon monoxide poisoning. It is important high yield thing that carbon monoxide binding to hemoglobin is 100 times more avidly than oxygen dioxide. You should know about that. Uh, monoxide binds hemoglobin 100 times more avidly than dioxide. Then come down here that pO2 is normal, capillary pressure is normal, and the hemoglobin binding capacity to oxygen is low. Why? Because monoxide is binding more rapidly than oxygen binding to hemoglobin. Okay? Normally, in methemoglobinemia, Fe2 normally binds to O2. Remember that Fe is the component of iron heme. Fe2 binds to oxygen normally. When Fe2 is oxidized to Fe3, oxygen cannot bind to it. So capillary pressure will be remain same, but the oxygen binding capacity to hemoglobin will be decreased.